There are so many rumors and myths which are floating around regarding the coronavirus, which has been the hot topic, and also the world has declared the health emergency. So many of the individuals have their own opinion about the coronavirus. In spite, the World Health Organization as well as the Center for Disease Control has been giving a proper educational resource to the general public. So here I am quoting the same resources, and I want to give the inputs to all the public about the coronavirus. Here we have the questionnaire regarding each and every point regarding the coronavirus infection. So the important question each and every individual has there in mind in the general public is who can catch this virus. So people living or traveling in an area where the novel coronavirus is circulating may be at a very greater risk of infection. And at present, this novel coronavirus is circulating in China, where the vast majority of the people infected have been reported. And those infected from other countries are among people who have recently traveled from China or who have been living or working closely with those travelers, such as the family members, co-workers, or maybe the medical professionals also. So who is caring for the patients before they knew that the patients was infected with the novel coronavirus. And the health workers caring for persons who are at a risk with the novel coronavirus are at a very higher risk and must protect themselves with an appropriate infection prevention, and the control procedures should be handled pretty carefully. And the people living outside of the areas in China where the virus is circulating are not at the risk of infection with the novel coronavirus. And the World Health Organization, that is WHO, is continuously monitoring the epidemiology of the outbreak to better understand where the virus is circulating and how people can protect themselves from this deadly infection. And when we talk about the severity of this illness, so who can get the severity of the illness is the big question for majority of the individuals. So the virus is very new, so we still need to learn more about how this new deadly novel coronavirus affects people. So thus far as the data what we are getting from the China, the older people and also the people with the pre-existing medical conditions, as I already mentioned, the diabetes and the heart diseases, these individuals appear to be at the greater risk of developing the severe form of illness, and it could be fatal and they may die because of this infection. So for all the general public, at present what is important is how to stop spreading of this virus. So the new coronavirus is a respiratory virus, right? Because the death happens because of a severe respiratory illness. So, and this is the virus which spreads primarily through contact with an infected person by means of respiratory droplets, which is generated when a person coughs or sneezes, or through the droplets of the saliva or discharge from the nose. So that is the reason whomever they have such kind of symptoms, they also have to take the personal care, and the healthcare worker who is treating these patients also should take a personal care because they are the one who are at a greater risk. So it is important that everyone, irrespective of the infected, not infected, healthcare professionals, everyone should practice good respiratory hygiene. For example, cough or sneeze into a flexed elbow or use a tissue and discard it immediately into the closed bin. And it is also very important for the people to wash their hands regularly with either alcohol-based hand rub or soap and water. And the maintenance of the hand hygiene as well as the respiratory hygiene is very, very important to spread this deadly virus infection in your community. So when we talk about the survival rate of the viruses and how long does it survive on the surfaces, so it is still not known how long that this novel coronavirus survives on surfaces. Although the preliminary information suggests that the virus may survive a few hours, and simple disinfectants can kill the viruses, making it no longer possible to infect the people. That is the reason again and again I want to repeat the same word, that maintenance of the hygiene is extremely important to prevent the spread of the infection to you as well as to the community as well. So majority of the people have a doubt, because these days whomever they got common cold, cough or sneeze, even with the fever, they got immediately devastated thinking that it is a novel coronavirus. So an important public information what you need to know is how it can be differentiated between the symptoms of the common cold and flu as well as the symptomatology what is arising from the novel coronavirus. So the people with the novel coronavirus infection, the flu or a cold, typically develop respiratory symptoms such as fever, cough and runny nose. So even though many symptoms are alike, they are caused by the different viruses. So because of their similarities, it is difficult to identify the disease based on symptoms alone. So that's why the laboratory tests are required to confirm if someone has the novel coronavirus. So as always, we have to take the guidelines from the World Health Organization. The WHO recommends that the people who have cough, fever, as well as the difficulty in breathing should seek medical care as early as possible, and the patients should inform the healthcare providers if they have traveled in the 14 days before they developed such kind of symptoms, or they have been in close contact with someone who has been sick with the respiratory symptoms. So the question is, how long is the incubation period? So the incubation period is a time between infection and the onset of the clinical symptoms of the disease. So the current scenario actually estimates of the incubation period, which is ranging between 2 to 11 days, and these estimates will be refined as more data become evident as well as available these days. And based on the information from the other coronavirus diseases such as MERS as well as SARS, the incubation period of the novel coronavirus could be up to 14 days. So here it is very important in understanding the time when infected patients may spread the viruses to others. It is critical for control efforts. So detailed medical information from the people infected is needed to determine the infectious period of the novel coronavirus. And according to the recent reports, it may be possible that the people infected with the novel coronavirus may be infectious before showing the significant symptoms. However, based on the currently available data, the people who have symptoms are causing the majority of the virus spread. So what is the advice what we have to take from the World Health Organization? So the advice what we can take from the WHO, which has been issued to the people on how to protect themselves from the novel coronavirus infection. So as for any virus that spread via respiratory route. In addition, it is vitally important in healthcare settings that the healthcare workers are able to protect themselves from the infection. And WHO guidance on infection prevention and control measures in healthcare facilities should be taken at any cost. Yes, many people have a doubt also that can I receive any kind of a packages or the parcels or the couriers if you receive from China? Yes, it is absolutely safe because the people receiving packages are not at all at a risk of contracting the new coronaviruses. So from experience with other coronaviruses, we can clearly say that these type of viruses do not survive long on objects such as letters or packages. That's the reason do not worry about this point at all. So many people are taking antibiotics like they generally do on counter medications for all different types of flu as well as respiratory illness. No, not at all. Here you should not take any kind of antibiotics because antibiotics do not work on viruses. They only work on bacteria, that is bacterial infections. So the novel coronavirus is a virus, right? So and therefore the antibiotics should not be used as a means of prevention or a treatment. So talking about the treatment, many people have a doubt, and there are also pretty rumors as well as myths regarding the treatment, and many people are also taking the treatment and some people are also selling the medication in the name of the treatment for the novel coronavirus. But remember, as from the up-to-date, as from the data what we have received from the WHO as well as from the Center for Disease Control, till date there is no specific medicine recommended to prevent or treat the novel coronavirus. But however, those infected with the novel coronavirus should receive an appropriate care, especially to relieve as well as to treat symptoms, and those with the severe illness should receive optimized supportive care. And there are some specific treatments are under investigation and will be tested by means of clinical trials. Approximately it may take 4 to 6 months for these medicine to be available for the general public. So the WHO is helping actually to coordinate efforts to develop the medicines and also to treat the novel coronavirus with a wide range of partners of WHO. And especially here, if you want to protect yourself from getting infected with the new coronavirus, you should maintain a basic hand as well as respiratory hygiene and safe food practices, and also avoid close contact and when possible with anyone showing such kind of symptoms like respiratory illness such as coughing and sneezing, which is associated with the fever. So many people are following certain measures which are not specifically recommended as the novel coronavirus remedies, as they are not effective to protect yourself and can be even harmful, like people are taking the vitamin C, or like smoking, drinking traditional herbal teas, and wearing multiple masks to maximize the protection, taking self-medication such as antibiotics, right? So all these are not effective at all. So in any case, if you have a fever, cough and difficulty in breathing, you have to seek the medical care as early as possible to reduce the risk of developing a more severe form of infection from the deadly coronavirus, and also be sure to share your recent travel history with your healthcare provider. So stay safe and stay healthy from the deadly coronavirus.